It really feels like it's March 2020 again. Record high case counts, a shortage of tests, and schools moving to remote learning.
And we will see that happen in more schools over the next few weeks. There are too many staff impacted by COVID-19.
Also, our hospitals are filling up fast. So if you only have mild symptoms, doctors and nurses want you to stay away from the ER.
We're seeing a not insignificant amount of patients coming to the ER who may have no symptoms whatsoever, just needing a test.
Here's the story.
And I'm Maggie Vespa. Welcome to The Story on this Friday. Thankfully, it is Friday. That's some good news tonight. If you're not familiar, this is the show where your questions and your comments seriously drive our content, as you'll see. So email the story at kgw.com and use that hashtag, #TheStoryKGW. Now, loyal viewers of this show know that we're not a big breaking news show, but we do want to start really quick with an update on this situation because these floods are impacting a lot of people. Our helicopter, Sky 8, shot this video near Chehalis today, and the flooding was so bad it shut down a 20-mile stretch of I-5. The water is now starting to recede, and the freeway was back open. But at the time, it virtually cut Seattle off from pretty much everywhere else. Jake Wittenberg from our sister station in Seattle tweeted, "Seattle is now an island with all 4 mountain passes are also closed." Yikes. And a photographer there tweeted out a map showing all the major highway closures around Western Washington. He said, quote, "It might be time to go buy all the toilet paper and eggs." Whoa, 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 whoa. Let's not get back into that mind frame again. We do want to remind everybody, I-5 is back open in Chehalis. There is no need for the insane panic buying. We have all the latest on this at kgw.com, and Matt Safino will have your full forecast at 6:30. But for now, let's get to the big story. Tonight's big story, check out this really big number behind me. Today, Oregon reported more than 10,000 new cases of COVID-19. You can see 10,451 to be exact. That is by far the highest daily case count Oregon has ever reported. And to put this in perspective, the record 1 week ago was 3,500. 10,451 now. Hospitalizations are also increasing. And in short, doctors say this surge is really going to start impacting our daily lives.
I suspect all of us are going to feel the squeeze of Omicron spreading quickly through our communities and people calling out sick. That's going to disrupt services. It's going to disrupt hospitals, childcare, businesses, public services as people stay home when they're sick, which is the right thing to do. But it means that we're all going to feel, excuse me, it means we're all going to feel some strain around just the wave of illness that's going to pass through the community and effects on services that we're going to feel.
And this surge is already impacting schools. In fact, in Portland, 2 high schools went back to remote learning for at least the next week today. And state education officials say expect more schools to follow suit. Here's Christine Pitawanich.
Meet 17-year-old Natasha. She's a junior at Cleveland High School and says many students have been uneasy going to school in person this year, being around so many people.
It was like we were all walking on eggshells and it would all fall apart like at any moment and it did.
On Friday, both her school, Cleveland High, and McDaniel High School had to temporarily transition to distance learning for a week because there were so many COVID-related absences among staff and students. District leaders say with the variant spreading rapidly and the situation being so dynamic, there could be more schools that may need to go virtual.
Even as we looked at the numbers yesterday, we made the call on 2 high schools, but there were several others that also were concerning, but where we felt that we could cover those absences. Unfortunately, it looks like we may have other schools where we'll need to go through our decision-making process and work with our school leaders there to decide if that's the right call.
And we should be going back online, and it's the best to keep us safe. But I am wary, and it feels like very recent history is repeating itself.
And now Natasha is concerned about her peers. She sent us these photos from her friends at other schools. You can see students shoulder to shoulder walking to class or eating in groups, crammed in hallways. Some students are wearing masks, others aren't. On its Facebook page, the Portland Association of Teachers reposted a Roosevelt High School student's comments that said in part, "I do not feel safe here. Kids are catching COVID every day and still attending school, so they don't miss out on sports and class. If I don't come to school, I fail. And if I do come, I risk catching COVID."
Okay, Christine Pittawant's joining us now. So Christine, obviously a ton to unpack here, which has sort of been the theme throughout the pandemic. And once again, we have so many changes and they're happening so quickly.
Oh, I know. And really quickly, it's worth mentioning, Maggie, that at those two schools involved, extracurricular activities are on pause. But yes, so many changes happening at school districts trying to keep up with what's going on in this variant. Earlier this week, though, we heard from Beaverton schools. For instance, they're pausing one of their student testing programs. And today, we heard they're also pausing volunteers and visitors, and they're also taking other precautions.
We're now requiring masking in our band classes, which we previously had not done, and we have reinstituted our masking outdoors. So kids who are outside for recess or have some sort of outside class now have to wear masks again outdoors. I think maybe the biggest change has to do with athletics, band, and choir. So we're really limiting the capacity at athletic games and band and choir concerts. No student spectators will be allowed at those events.
So the only exception, family. Student athletes and performers will get 4 tickets for their family members. So yeah, lots of changes. I'm sure more to come. Maggie?
Yeah, we can definitely count on it at this point. All right, Christine Pittawant, thank you so much for tracking all of that for us. We appreciate it. We want to get to an email now from a viewer named John. He wrote, "My name is John Seeley. I am an emergency room nurse, and I am begging you to help us. Over the past week, we have seen an exponential rise in patients coming to the emergency department for minor symptoms of COVID or people just coming for a COVID test." He went on, he said, "The healthcare systems are almost to a breaking point in the Portland metro area, and we need everyone's help. Understand that all, not just minor COVID symptom patients, are waiting multiple hours to be seen by a physician because of this increased strain. Healthcare staff are stretched thin and frustrated." He added, "You called us healthcare heroes a year ago. We are asking the community to be our heroes now and help us out." Wow. John, thank you so much for your email and again for the work that you're doing in the emergency room. Our staff was actually so struck by what John wrote and what he's seeing now that we reached out to him to talk more about it. Here's what he said.
Spreading like wildfire right now. And so I would say over the last week, we've seen an exponential rise in just COVID cases in the area. That doesn't necessarily mean that they're all extremely sick. It's just a lot of people that either need tests for school or travel or just a peace of mind are coming into the emergency department to get tests because they can't get into an urgent care because they're maxed out or they can't find a test at their local pharmacy store.
Other healthcare workers we talked to were really glad that somebody brought that up because they say they're seeing the exact same thing.
Right now, the situation you would find in a Portland ER is a very long wait of potentially 10 hours or more isn't uncommon. I heard of a 16-hour wait just this week, particularly if you are coming after hours. So if you have mild symptoms, please go get a COVID test and then talk to your local healthcare provider about potential treatment options or how you can isolate at home and potentially treat your symptoms.
Now, they each wanted to emphasize if you have a true emergency, that's when you go to the emergency room. Absolutely do that. Your life is in danger. If that's the case, it's still the best place to go and they can still treat you there. But if you have minor symptoms or if you can't find a COVID test, it is best to go somewhere else.
If you're having symptoms, a lot of people are experiencing mild to moderate cold symptoms. So quite honestly, if you don't feel very sick and you feel like you just have a cold, it may be worth getting testing. But again, that alone may not necessarily warrant going to the emergency room.
Now, the Oregon Health Authority announced today they will be creating a case support hotline for you to call if you test positive for COVID, but you don't need urgent medical care. We'll let you know when that hotline is up and running. Now, the OHA also today put out guidelines telling hospitals how they should act if the time comes to begin having to ration care. KGW's Pat Doris joins me here to talk about that. Pat?
Well, Maggie, it's kind of chilling to think that they need to do this, but the fact is that even though Omicron gives a milder case for a lot of people of the coronavirus, that there'll be enough people, because it's going to be a huge swath of folks getting infected, there'll be enough in that small category that get very, very sick that the hospitals could be overrun. It could be a huge problem. They're estimating as many as 1,600 people into the hospitals, and that's about 500 more than was at the height of the big surge that we had in September. So a lot of folks are very concerned about that.
Yeah, understandably so. Can you tell us more about, these guidelines and how they would help if that situation does come to fruition?
Well, and we want to be clear that we're not there yet. This is just sort of in case. But if a hospital is full and all the hospitals are full and there's no place to send other patients, and for example, they don't have enough ventilators, they don't have enough ICU beds, this sets up a procedure where they will go in and rank the different patients that need this highest level of care. And there's a number of different medical objectives that they'll use to analyze people so that hopefully you take, the race base and economics and everything out of it, and it's just purely a medical decision. And people will get a number, and the lower the number, the better, because that means that you have the highest likelihood of surviving your hospital stay, which is really the metric that they're looking at, who's going to make it and who's not. And for the people that are having a higher number, they may not get that ventilator. They may be denied. The care may be rationed. And it'll be a brutal decision, but it's one that they think they may need to make in a few weeks. We'll see. Hopefully not, but that's why they're doing this.
I know we've talked about this with doctors before, and they've always explained it as they try to give the care to those who will benefit the most, not those who deserve it the most. All right, Pat Doris with that update for us. Pat, thank you for the info.
As promised, Nicholas Kristoff is taking his fight to run for governor to the state Supreme Court. And a lot of you are asking, what exactly is the legal definition of a resident here in Oregon? The thing is, there's no clear answer. When the story continues.
Welcome back. Keep sending in those questions and comments to thestory@kgw.com or use that hashtag #TheStoryKGW on Twitter. We have gotten so many questions about this next story. A lot of you had a lot to say and a lot to ask about the Nicholas Kristoff ruling. But first, a quick update on that story. Actually, as expected, Kristoff today formally requested the Oregon Supreme Court review the Secretary of State's decision to disqualify him from the governor's race. The secretary announced yesterday Kristoff is ineligible to run. The reason? For the last 3 years, she said, Kristoff has not been living as a resident of Oregon as required by the state's constitution. She said Kristoff hasn't voted here. He hasn't even proven he paid income taxes here. In short, she said the longtime New York Times columnist has clearly been living as a New Yorker.
In the end, our elections officials told me it wasn't even a close call.
Well, my willingness to challenge the status quo is the reason state officials are trying to toss me from the ballot.
Kristoff was born in Oregon and owns property in Yamhill County. In his filing today, his campaign argued Kristoff satisfies Oregon's residency requirement because he lives in Oregon and has viewed and treated Oregon as his home for decades. They're obviously hoping the state Supreme Court agrees and makes a decision quickly because the state has to start printing ballots for the primary in March. But meantime, let's drill down a little bit on this because our viewer Rod nailed a core issue in this case by asking, concerning the Kristoff situation, what is the legal definition of resident? Rod, awesome question. Again, that is the core issue. In short, there is no legal definition of resident, at least not in this context. There's no case law defining it, and the Oregon Constitution doesn't define it either. In fact, here's the passage from the Oregon Constitution that details the requirements to run for governor. And the original phrasing obviously makes it a little bit confusing. It's kind of old-timey, but it says, think of it like this. No one can run for governor except those who are U.S. citizens, at least 30 years old, and a resident within this state for 3 years preceding their election. But that's it. That's all it says. That's all the passage details about that point. It doesn't go into anything about what it means to be a resident in Oregon. And that's why the Secretary of State specifically explained the decision was based off of things like where Kristoff voted, where he paid taxes, even where he has his driver's license, New York, by the way. And it's also why this case could be historic. The Oregon Supreme Court could, if they decide to hear this case, give a more precise definition for officials to use moving forward. But in the meantime, we want to point you toward a piece we think is worth your time, especially if you need a laugh. Portland Monthly's managing editor Margaret Seiler penned a chef's kiss worthy satire titled, "What is residency, really?" She poked fun at how subjective the requirement clearly is and made a case for her eligibility to be considered a resident in all 50 states, one by one. Among her greatest hits, she says she was in Florida on spring break when Kurt Cobain died. So that covers Florida. She's a resident in Florida. She has a friend who, quote, looked so much like her growing up, they were often asked if they were twins. This friend now lives in Colorado. Or does she? She could easily be Seiler, who lives in Colorado. Checkbox for Colorado. The list goes on. And the piece ends with our quote of the day. Buckle up for this one. Quote, legal doctrine can sometimes deceive, inveigle, obfuscate. Even in a legal memorandum, it can be important to look down at the situation as if from the UFO on the poster in Fox Mulder's office and simply want to believe, to look past the Doug firs and to the enchanted forest, which Seiler finally went to last summer after 20 years in Oregon, and which is officially amazing. Margaret Seiler, she continues, is a resident of, insert state name here. That is obvious. Boom. Again, that is satire, but I got to say, from one Margaret to another, my God, bravo. Well done. Well done. All right, next viewer question. DJ asked, when you discuss his candidacy, could you report if he, meaning Kristoff, has filed Oregon state income taxes the last 3 years? DJ, fantastic question. So as we said, Kristoff argues that he paid income taxes in Oregon in 2019 and 2020, but he didn't provide proof. Yesterday, reporters asked why.
Well, we didn't provide the documents to the Secretary of State because she did not ask for them. If she had asked for that or for anything else, we would have been happy to provide it.
Okay, there you go. Then there came the follow-up question.
Why not provide it to the press?
We will indeed provide our tax returns along with other candidates later, as is traditional. We wanted to honor the Secretary of State's inquiry while this was in the works. And we are disappointed that it did not go differently.
Okay, DJ, that is Kristoff's answer as far as his taxes go. Do with that what you will. All right, weird question. How many of you like explosions? If so, good for you, weird hobby, but we definitely do because they make for pretty good TV. We're shallow people, whatever. We're gonna try to figure out the best explosion, or shall we say implosion, in the Pacific Northwest, and we want you to weigh in. That's next when the story continues. Welcome back. Did anyone watch the live stream of the Research Stadium implosion in Corvallis this morning? Well, fear not, because here it is. OSU, there she goes, demoed the west side of the stadium as part of a $153, and it's done, $1 million renovation project at the university. Now, we're trying to settle a little bit of a debate in our newsroom. Like, how good, in your opinion, was this implosion? On a scale of 1 to, say, like, I don't know, exploding whale. Let's use that metric, okay? Let's take a look at some of the other candidates, actually, for the best explosion or implosion in the Pacific Northwest. First up, here is the Trojan nuclear power plant implosion near Rainier, Oregon in 2006.
3, 2, 1, fire.
Yowza. Okay, so that is clearly a front runner. Also love the fast cuts. It's very Michael Bay. Next, let's check out the King Dome blowing up in Seattle in 2000. This is a Friday segment, if ever there was one. It is Fridaying so hard, and I love it. I think that one's even better. Like, that might be the best one yet, depending on your taste. Okay, now to everybody's favorite moment, the exploding whale on the Oregon coast back in 1970. Oh yeah, That's right. We don't have the rights to that video, so we can't show you the video, but we can show you this.
They blew this thing up all over the place. It looked like something from a Michael Bay movie. Not only that, a bunch of people had showed up, and they were standing nearby going, oh my gosh, what are they going to do with this whale? Can you believe they're going to blow it up? Which they then witnessed happen and got rained down upon with whale stuff and blubber and whale bones and all kind of gross stuff. And that's the story of when we blew up a whale.
Do we both say Michael Bay? Like, I remember Dan doing that, but I don't remember him saying that. I'm going to text him after this. That's so weird. Dan, thank you so much. Lovely to see you. So once again, with all of that context in mind, we're now more educated, right? Let's take a look again at this morning's implosion of Research Stadium. I didn't hear the cheering the first time. That was lovely. Not bad at all. You know, I don't think that's bad, okay? So we want to hear from you now, though. What is the best Pacific Northwest explosion or implosion? Is it the Trojan nuclear power plant, the one that I called Michael Bay? The King Dome, perhaps? The whale, which again, you would have to check out on YouTube or Google because ownership rights? Or is it Research Stadium? Let us know. Email thestory@kgw.com or use the hashtag #thestoryKGW on Twitter. I think our team had a little too much cold brew before we wrote that segment. That was fantastic. We're going to finish the show next. All right, y'all, we have time for one more viewer question. This one came from Mark. He wrote, didn't we spend millions fixing the overflow issue? Yet we still have overflows. The planning and execution of the Big Pipe project has been a bust. Mark, great question. Thank you so much. So sewage did overflow into the Willamette on Monday. That's why you brought this up, because of heavy rain. And the same thing happened a few weeks ago. But that does not mean the big pipes are a bust. Little perspective here. According to the city, before the pipes, the Willamette averaged about 50 overflows per year. Now, we average 5, which is actually exactly how many we had in 2021. So if you do the math, that means the big pipes have reduced overflows into the Willamette by 94%, roughly. They've also reduced overflows into the Columbia Slough by 99%. So based on the stats, the big pipes are actually working pretty well. But every time I see those headlines, I cringe too. So I totally get it. I do want to give a shout out to the viewer who called our newsroom just now and talked to our producer Kendall, and then Kendall sprinted into the control room to let our producer Stephanie know, we have so many producers, that they don't have Twitter, this viewer, but they want to vote for the exploding whale. Fantastic, fantastic. I love our viewers. That is so great. Follow us on Twitter at @TheStoryKGW or just call the newsroom, or you can email thestory@kgw.com. That does it for this show. Laurel Porter is standing by with the news at 6:30.